Good afternoon. I'm Hwabok-chae, the first speaker and a PhD student in nursing. The title of the study to be presented is The Effectiveness of Alcoholic Patient Care Simulation on Mental Health Nurses, a quasi-experimental design. The table of contents is as follows. It consists of the introduction, theoretical foundation, method, results, conclusions, the significance of the research, and reference. The first is the introduction. It consists of 3 parts. Mental health nurses care for patients who are suffering from mental illness, dysfunction, or mental disorder. They must possess the competencies to provide the best care for their patients. There are various competency improvement methods, including respect, compensation, and achievement, but education is the most effective. In order to carry out the training, the needs of participants should be identified first. The program that reflects those needs maximizes the effectiveness of the training and lead to competency improvement. Simulation is a scenario-based program that is effective in improving the competencies of nurses. It also reinforces learner skills by reproducing real-world situations in a controlled environment, providing opportunities to deal with various situations. In order to improve the competencies of mental health nurses, a practical simulation that increases immersion through indirect experience can be a countermeasure. Currently, some studies have been conducted on simulations related to mental health nursing, but mainly on students with little information on nurses. Thus, this study aims to identify the educational needs of mental health nurses and to evaluate the effects by developing and applying a simulation. The following is the definition of terms. For 6 terms, the original meanings and the descriptions in this study are as follows. Here is the theoretical foundation. It consists of 4 parts. The theoretical foundation of this study is the National League of Nursing, NLN, Jeffries Simulation Framework. This framework was developed to provide guidance when designing simulation training for successful learning and consists of 5 factors. The facilitator, participant, and educational practices influence the simulation design characteristics and outcomes. The simulation design characteristics affect the process in which the facilitator, participant, and educational practices influence the outcomes. Based on the NLN Jeffries simulation framework, the conceptual framework was structured as follows in this study. The components of each factor were changed to be suitable for this study. The hypothetical model is as follows. It is that the participation in simulation training will affect the nursing competency, self-efficacy, negative attitude, burden, stress, and anxiety of mental health nurses. The hypothesis of this study is as follows. Here is the method of this study. It consists of 6 parts. The following is about the research design, research objects, and sample size. This study was a quasi-experimental design. The experimental group took part in the simulation while the control group took part in video learning. The eligible people for this study were the mental health nurses who had more than a year of nursing experience in mental health facilities and who signed the consent form after receiving a detailed explanation of this study. The number of mental health nurses related to the survey was set at 109, considering previous research and the 30% dropout rate. The previous study was to identify the learning needs for health examination among 84 nurses. and the 30% dropout rate took into account the difficulty of recruiting nurses due to the specificity of the field of mental health nursing. The number of mental health nurses related to the simulation and video learning was set at 20. Considering effect size is 0.3, significance level is 0.05, statistical power is 0.8, and the 10% dropout rate. The Research Ethics Review Board, C University in South Korea, approved this study, and this is the approval number. Through an online notice posted on social network service for 2 weeks, nurses working at mental health facilities in Gyeonggi Province were recruited. Survey participants completed the questionnaire on the past training experience and educational needs, while the participants of the simulation and video learning completed the pre- and post-test. The following are the research tools. A total of 6 tools were used. The 4 tools above have been modified to be suitable for this study and have been validated by 5 experts with more than 3 years' experience in alcoholic patient care. Thus, there was no prior psychometric information as to the 4 tools. The stress and anxiety tools use the numerical rating scale, NRS, which is a tool to quantify the target people's subjective feelings from 0 to 10 points by questioning them directly. This table is the content validity of the 4 tools evaluated by 5 experts, except for question number 16, which is item level CVI is 0.2 in the burden tool. The final number of questions was the same as the number of questions initially created. The following is the simulation program. Based on the results of the survey, an alcoholic patient care simulation was developed. The experimental group participated in the simulation program. A standardized patient, SP, skilled in the field of mental health, was recruited to maximize the simulation effect. The goals of the simulation program were that mental health nurses had to be able to observe and evaluate alcoholic patients and had to build therapeutic relationships with them. The following is the simulation scenes of the SP and participants in this study. The control group participated in video learning. They watched a 30-minute video clip of alcoholism and medication, psychological and social therapy, and nursing. The homepage addresses at the bottom are video URL and questionnaire URL. Data analysis was performed using the IBM SPSS Statistics version 25 software. The data of this study were analyzed using descriptive statistics, features exact test, parity test, two-way repeated measures ANOVA, and ETA-scale. Here are the results of this study. It consists of 3 parts. The following are the baseline characteristics of participants. 119 nurses filled out the survey questionnaire, even though the required sample size was 109. 110 questionnaires were finally analyzed, excluding 9 duplicated or incomplete questionnaires. All 20 nurses participated in the alcoholic patient training, 10 in simulation, and the other 10 in video learning. There were no significant differences in baseline characteristics among survey groups, experimental groups, and control groups. The following is the past training experience and educational needs of mental health nurses. Mental health nurses responded that they received the most training on the special situation response, followed by communication. Their educational needs were likewise the highest in the special situation response, followed by communication. Here, the special situation response means dealing with frequently occurring problems at mental health facilities, such as aggressive changes of patients, their hospitalization rejection, and human rights violations. Lastly, this table shows the effects of simulation by groups over time. The mean score of the nursing competency and self-efficacy in the experimental group significantly increased at the post-test, while the mean score of nursing competency in the control group showed a small increase over time. The mean score of the negative attitude, burden, stress, and anxiety in the experimental group significantly decreased at the post-test, while the mean score of the anxiety in the control group showed a small decrease over time. Analysis of the simple mean effect test results on the 6 measurements showed a significant difference between groups in the post-test and a significant difference over time in the experimental group. The estimated effect size was large in all 6 measurements. Here are the conclusions of this study. The educational program, reflecting the needs of participants, maximizes the effectiveness and the collaboration experience with a standardized patient. SP provided mental health nurses with opportunities to improve practical competencies such as the special situation response and communication skills, unlike the video learning. Thus, alcoholic patient care simulation is a practical educational approach based on the learning needs of mental health nurses and is a useful way to provide a learning experience similar to actual nursing services. Here is the significance of the research. This study is meaningful in terms of nursing theory, nursing practice, and nursing research as follows. Here are the reference lists. This study did not receive any specific grant from agencies in the public, commercial, or not-for-profit sectors. The researcher thanks to the mental health nurses who participated and all those who helped with this study. That concludes the presentation. Please let me know if you have any comments regarding my research. Thank you.